So what is pelvic floor dysfunction? Pelvic floor dysfunction can, like I said, present in many different ways, right? It is a dysfunction in the musculoskeletal and neurological support of the pelvic floor. Physical therapists are experts in the musculoskeletal system. Most MDs may only look at the organs and their function and not underlying musculoskeletal dysfunction. So physical therapists will look at your muscles, will look at the scar tissue, the nerves, the connective tissue to figure out what is going on and how we can help you. Pelvic floor dysfunction can result due to trauma, surgery, childbirth, with perineal tears and episiotomies, accidents such as with horse riding, bicycling, and sometimes no known cause at all. What ends up happening is the pelvic floor muscles become short and weak, which means they go into a spasm, which is a protective mechanism of the muscle to protect itself and the area that it's supporting. And this in turn leads to the muscles becoming weak. So then, pelvic floor dysfunction will present as pelvic pain, again, incontinence, constipation, and all of this affects a human's quality of life. Trauma can also lead to the pelvis, can result in long-term chronic, dysfunction due to scar tissue. The scar tissue, whenever we have trauma, we have scar tissue. The scar tissue gets adhered or gets stuck. And if it's not worked on, it then pulls on all the muscles and, connective tissue and supportive tissue around that area. It is really important for us to advocate for our pelvic health, especially for women, because there's not a lot of information out there and not a lot of healthcare practitioners are trained specifically in the pelvic floor and the support system of the pelvic floor. Can we get to the next slide, please? So how does physical therapy help? Physical therapy, pelvic PTs can help to restore and balance pelvic activity and function. We use individualized treatment techniques for rehabilitation, based on an extensive evaluation assessment. Treatment techniques that I use include postural alignment of the pelvis, internal and external pelvic muscle assessment and treatment. We do digital treatment of the pelvic floor muscles, neuromuscular re-education, and of course, a home exercise program, which includes the use of dilators or wands to stretch the pelvic floor muscles at home. And also we teach patients how to do skin rolling and scar tissue release to have everything flowing optimally around the pelvic floor.